Hey mama, welcome back to our pregnancy series. In this video, we will discuss week 35 of your pregnancy. Congratulations, you are now in your final stretch. At 35 weeks of pregnancy, your baby is about the size of a honeydew melon and weighs around 5.5 pounds. Your baby's lungs are almost fully developed and they are practicing their own breathing movements. They are also starting to shed the downy hair covering their body, known as lanugo. You may feel a bit uncomfortable at this point as your uterus continues to expand and put pressure on your organs. You may also experience some Braxton Hicks contraction, which are practice contractions that help prepare your body for labor. These contractions may become more frequent and intense as your due date approaches, but they should not be painful. If you experience painful contraction, be sure to contact your healthcare provider. At this stage, your healthcare provider may be monitoring your baby's position to ensure that they are optimally positioned for delivery. If your baby is in a breech position, your provider may suggest a procedure called an external cephalic version to try and turn your baby around. As you near the end of your pregnancy, it is important to keep an eye out for any signs of labor. Some common signs of labor include regular contractions that increase in intensity and frequency, a bloody show, which is a small amount of blood-tinged mucus that is released as the cervix begins to soften and dilate, your water breaking, which is the release of amniotic fluid, a sudden burst of energy, also known as nesting. If you experience any of these signs, be sure to contact your healthcare provider. In conclusion, at 35 weeks, your baby is almost fully developed and getting ready for their arrival. Although you may be feeling a bit uncomfortable, it is important to stay active and take care of yourself in these final weeks. Keep an eye out for any signs of labor and don't hesitate to reach out to your healthcare provider if any concerns arise. Thanks for tuning in and we'll see you in our next video. But most importantly, don't ever forget, you know how to mom.